show. And if you're just tuning in, this is the Health Matters show. Like I earlier said, we have a medical practitioner here with us in the studio.
Nice to join you here this lovely evening.
Okay, so please introduce yourself to the house.
My name is Dr. Leslie.
Okay.
Funny thing is, staying in the Yoruba land, they've actually tried to Yorubanize my name. They call me Leslie. It's very funny.
Yeah.
But my name is Dr. Leslie, and
okay.
It's lovely to join you today.
Thank you for coming on the show. So we're just going to jump right to the questions for our topic of the day. Now, what is vaginal discharge?
Okay, really, it is quite ironic that there is no specific definition for vaginal discharge, because on its own, vaginal discharge is an abnormal condition. You are not supposed to have a discharge whatsoever. Mm. So seeing a discharge, you're already having an abnormal condition. So it's already abnormal.
All right, so thank you for that. But you said it's abnormal. Yes. I've heard some doctors or medical practitioners say that you are bound to have some slight discharge or some slight secretion coming from your body, but that doesn't mean that it's abnormal.
Yeah, usually what they mean by that is, and that is usually noticed during your ovulation period. Okay. It's just the normal mucus. It's like saliva, very thick saliva, colorless, odorless, and it doesn't even come down. It's just within the vagina. Okay. That is where it is. But when you are having an abnormal discharge, the discharge is stays within and somehow comes out of your vagina. So that is when it becomes a problem. Okay. We're actually having this conversation before we jumped in live now. Yeah. the discharge, I as a doctor and practicing, I get so many patients coming in and they are telling me that they have vaginal discharge. And one of the most common things that I found really interesting, very, very interesting, is that there's always one thing in common: they themselves and then their practices. And the practice just involves them washing around the vagina, inside the vagina rather. And that practice, it's really funny because, it's logical for you to wash, because you wash your skin, you wash your face, you brush your teeth, you wash your mouth. So why not just wash the vagina so it's clean? But on the very base of it, that practice is actually the common result of this vaginal discharge that most women come and complain about.
Okay. Yes. So now we're talking about cleaning the vagina. Yes. Now we've heard medical practitioners tell us that it's not good to use soap and the likes of it. Now, in the case where there are females that use, like we said, Oriflame products to take care of that particular environment. Now, do these chemical products have an effect on the female?
Yes. And please, we were talking about this earlier. I mentioned that Oriflame, we don't get to review all these products with the doctor. Okay. There are companies that make multi-million-dollar companies that are just based on just washing alone of the vagina. Yes. And yet, we still see more women coming down with, I use so and so product, but I still have discharge. Yes. I use so and so product. I use so and so product, but I still have this discharge. I use so and so product, but I still have this discharge. So what is the problem? And that's what I was mentioning to you, please, that there is a multi-million-dollar company where they will tell you that I will provide you with this product. You use it, you wash within the vagina, and then your vagina will have a sweet, fruity smell. We smell like pineapple, we smell like juice. Yeah. And then in my head, I'm like, why would you want your vagina to smell like fruits? Yeah. Because normally the vagina is not supposed to even have a smell in the first place. Okay. So you can see that already the companies are making money from the ignorance. And then you come down with fruity smelling vagina with discharge. And then your partner comes and tells me, while you're having a consultation, that he can't stand you because your vagina is smelling, and that they are at the brink of losing their marriage or relationship or whatsoever. So you can see that there's actually a fundamental problem that we have not really addressed.
Okay. So another question. Now, is it only females that are prone to have urinary infections? Do males also have urinary tract infections?
Yes, and then that's the point I would want to correct. In the beginning, when we have this conversation, you mentioned vaginal discharge and urinary tract infection.
Yeah.
They are two different things.
Okay.
Yes, but one can lead to the other.
All right.
Vaginal discharge can lead to urinary tract infection.
Okay.
And the reason we call it urinary tract infection is because if you look at the female private parts, for example, there is a place where urine comes out from. That is where the organism from the vagina can go and settle down, causing irritation there. Once it starts causing that irritation, that is when we now call it urinary tract infection. So one can lead to another. And then male and female, both of them equally can get urinary tract infection, but the females are more prominent because of the vagina. Because really the vagina, if you look at the vagina and the anus for the females, the anus is closer to the vagina. And then there are microorganisms within the anus that can creep to the vagina and then cause an infection. When the woman has washed the vagina, cause an infection there, and then will now spread to the place urine comes out from, and then cause irritation, leading to the urinary tract infection. So you see, it's one thing leading to another, leading to another, leading to another.
So men too now are prone
Yes,
to...
men are prone, especially when they meet with their spouse, their partners. They are at risk of contacting this. And then because the male phallus is just like a pipe, really. So when they mix with their partners, the partners tend to transmit the infection to them. Yes, and then when it starts irritating the place urine comes out, the opening where urine comes out, that is when we say the male has urinary tract infection. But the two of them are prone to having, but the females have a higher risk of getting urinary tract infection.
So since you said the males can get it through sexual means, now can you classify the UTI as an STI as well?
Yes, well, STIs can result in UTI. I don't know if you understand. Because again, the organism causing the STI can be carried by the females. And then when the man meets with the female, she transmits the organism to the male, sexually to the male. Because these things, they can be in the body fluids, secretions, and the rest. So when she transmits it to the male, once the organism starts multiplying within the opening, that opening where urine is coming out from, in the male phallus now, that is when we can now say they have urinary tract infection, which came as a result of sexually transmitted infection. So one of them leads to another again.
So now for treatment measures, I've heard ladies say they do what they call douching.
Yes, and that douching, that is what I've been calling the washing. Because before now, it has been a practice, goes way before you were born, before you and I were born. So this practice has been on for years, more than 50 years, up 60 years, 70 years plus. The practice, it just involves the woman, as I explained earlier, looking at her body as an extension of the whole human body, and then considering it that, oh, since my body, I wash my hand, I wash my face, I wash my mouth, why don't I just wash
that area as well?
The area, which is the vagina now. Why don't I just wash it? That process of washing it automatically changes the environment around the vagina. The normal environment of the vagina, God has made it such that you don't wash, automatically it prevents itself from having infection. In other words, even if an infection comes, there are ways the vagina fights those infections that it doesn't spread further. So when you wash now, you remove all these protective measures that have been put in place. And then you are creating a new room for the organism to thrive and multiply. So once it starts multiplying, that is when you now start coming and you're saying, it is the toilet that I'm using. You start blaming it on the toilet. Meanwhile, it's a practice that you've been doing on your own. I mean, to give a very good example, about last week, I was discussing with a friend, and we had a conversation about vaginal discharge. Very, very ironic. And now I'm here. We had a conversation about vaginal discharge. And then she started asking the question that, how come women, females particularly, living in the same room, how come each of them come down with the same thing, vaginal discharge, vaginal discharge, vaginal discharge? Could it be that it's the toilet that all of them were using? And then I told her, okay, let's go with logic. Let's follow a logical approach. Male and females, they use the toilet. If the males and females use the toilet, how come the females are getting it more than the males? And then she couldn't answer. And I told her that, okay, let's even go deeper. Males tend not to be more hygienic than females. So if the males are not hygienic than females, why is it that the males are not getting the infection and the females are always getting the infection? Is it that God has now come down and caused the females that you must get toilet infection? And again, to correct that notion, there is nothing in this world, there is no such thing as toilet infection. I repeat, there is nothing like toilet infection. I hear this too much. I hear it too often. There is no such thing as a toilet infection. You cannot get an infection from sitting on the toilet. Even if the toilet is dirty, you can't get an infection. Why? Because where is the infection going to pass to enter your body? Where?
Maybe this will vaporize.
I don't know. But and this has come to be the normal in Nigeria, where we see, even I get patients, female patients, coming to my consulting room and telling me that they have toilet infection, and when I tell them no, you don't have, it's something like it's strange to them. Like, why would you say I don't have the toilet infection?
We're already used to that term. We are used
to the term toilet infection, and this has come from the fact that many of us always prefer to go and listen to what them say. So and so person said it, so therefore it's the norm, right? So when I as a professional now talks to them, it's like, come on, what do you mean? Are you sure this doctor knows what he's saying? I don't think he knows what he's saying. I'll go and do my own research. And when they do their own research, they come back with anxiety disorders and come and start meeting me that, oh doctor, I have cancer of the cervix, I have this. Oh, what should I do? And then I'll tell them that, oh, you've done your research,
you've already diagnosed yourself,
you've gotten your answer, so don't meet me. I'm not going to unchange what you've done. So it's really very funny and ironic that you can see that women just do washing. Just by washing alone, you've already started causing 1, 2, 3, 4, 5 females living in one apartment having the same complications, as the vaginal discharge. And that being said, personal hygiene matters. Right? Personal hygiene, just washing around. I think that's the mistake we make. When you tell them wash around the private part, they feel you are saying you should wash inside the private part. Meanwhile, we just wash around. Just wash around the private part. So, again, let me give the commonest example I hear far too often. If you take a stroll in the market, you will hear there's this big speaker that they have there. You have this man, I don't know his name. The name varies from location to location, but they call themselves doctors. Herbal doctors. And then they will advertise this, their product whatsoever.
That treats.
And then they always mention something. Yeast infection, staphylococcus, and this. And again, these are uneducated people telling us. Majority of the masses in Nigeria are literate. We have a 60% literacy rate here. In other words, we can read, 6 out of every 10 Nigerians can read and write. So if that is the case, and then these people are telling us there's staphylococcus, there's this, a very quick one piece. If we go to Google now, and then you type toilet infection, you will discover that the search there is no search. You won't even see any related search to toilet infection. What does that tell us?
Yeah, I did that this morning and I saw yeast infection instead.
It tells you that the concept, the very nature of toilet infection does not exist anywhere in the world. There is nothing like toilet infection. And then you have these people in the markets, in the churches telling us that we are prone to toilet infection. This is that you have to do a test, you have to do and check for staph aureus. If you ask these people what is the meaning of staph aureus, they can't tell you. They can't even explain how you get the staph aureus. They just tell you your toilet is dirty. When you sit down in the toilet, you get the infection. How? We can't tell. And then when you have professionals come in and say there's no such thing as toilet infection, it's like
You've said something
he doesn't know what he's talking about.
Saying,
he does not know what he's saying.
Yes. So now we've established the fact that vaginal discharge or yeast infection is gotten from washing inside the vagina. Yes. Okay. Now I also mentioned douching. Now I've heard that it's a process where ladies use vapor from hot water to treat infections. Now, is that hygienic?
Again, we have these myths, uneducated people, average Nigerians who just have basic primary 6 level of education telling an educated college graduate in Nigeria that you use vapor to treat the infection. That thing doesn't exist. It does not exist.
Okay.
It's just a fallacy that we use, an uneducated person trying to be logical, teach the younger generation or the masses that what is supposed to come from the professionals, which are the doctors and the rest of them. You understand? And then they come up with these various practices. And I think the issue is we don't have more females coming to speak about their experiences from all of this. We don't have more females talking about what they've gone through. If you just seek information, you will get. But seeking the information from the right source is what that matters. Again, education is costly. Ignorance is expensive. Because at the long run, you will pay more money than you would have just knowing what it costs than.
Okay, so a quick one. What are the medical treatment procedures for vaginal discharge?
Oh, very, very simply, if you notice a vaginal discharge, the first and the foremost thing is that you have to seek a professional help. Go and see a doctor.
So instead of treating yourself,
you cannot achieve treatment by treating yourself, because we don't know how far the infection has gone. Because again, this infection that we're talking of can be it yeast, be it bacteria, it can spread and enter your kidneys. Once it starts entering your kidneys, you start complaining of this pain, usually at the right or the left side of your tummy. It doesn't go away. It's a very sharp pain. You always keep complaining about that pain. It goes, sometimes it just offers you little relief, but it comes in as a very, very sharp pain. That's already telling you that it's already involved the kidney. That is another ball game on its own. You know, so the first thing and foremost, once you notice the discharge, seek medical help. Then, once you seek medical help, we usually will tell you, once we've given you treatment, we will tell you personal hygiene matters, right? So now you have your underwears, and I see these practices so common. You know, women, they are afraid that, you know, when you hang your underwears inside, you are scared that somebody might use it for rituals, you know. But again, once you spread it inside and it's in a damp environment, these yeasts that we're talking of, they're very microscopic, so they can stay. Once you've already started having the discharge, they can stay in your underwear. So once you don't wash your underwear and sun adequately with sunlight, direct heat from the sunlight touching it, you'll discover that even if we treat you, you'll come again and then you will say, I'm still having vaginal discharge again, because your personal hygiene is questionable. So what we do is we tell them, usually soak your underwears in hot water, because the yeast cannot survive in hot water. The bacteria cannot survive in hot water. So soak it in hot water and then add a little bit of bleach inside. And then you leave overnight and wash. And once you wash, you sun it outside to get adequate sunlight touching it. And once you've done that, while you're receiving treatment, we usually advise you get a new pair of underwear. So that once you use one per day, so once you are using that one and then the new ones coming from the sun, you will discover that it's little or nothing.
Okay.
Then secondly, women tend to infect their partners, like I mentioned earlier.
Yes.
So treating the man and treating the woman at the same time will help. So those are basic measures, but the main thing, seek professional help. Go and see a doctor.
All right. Thank you, Dr. Leslie, for this brief educative moment.